Hi everyone. Welcome back. So, just gonna pass it on to Andrew. Um, Andrew, do you want to talk about? You did a tweet where there was this so-called headline in the Evening Standard saying that there's been a really low uptake in the vaccine, and you were just going through the numbers. Do you want to go through that, Andrew?
Yeah, so the Evening Standard has kind of run a couple of stories about this over the last couple of days, written by Ross Liddell, who's their journalist. And kind of the headlines are really sort of striking. So the headline basically says only 1 in 10 people in Tower Hamlets has got the vaccine so far, and that's really low. And what we've been trying to point back to him is that there are two completely separate things going on in Tower Hamlets, both in which areas we're slightly unique. So one of which is we're a very young borough. So we have the lowest proportion of people aged over 65 of any borough in the country. And we are the 5th youngest borough in the country. So if you look at the average age of people in Tower Hamlets is about 30. And the UK average is 40. So we're 10 years younger than the average. So if you're thinking about vaccines mainly so far being given to older people, because we don't have many old people in comparison to other areas. As a result, definitely we have a low vaccine uptake. But there's a second, much more important issue, which is the main issue to discuss tonight, which is then the uptake by ethnic group. So the numbers that he quoted, and they're similar to what I quoted a couple of weeks ago. So what he has reported, and this is coming from the council, so 56% of Black people over 70 have been vaccinated so far. That's compared to 69% of South Asians. And actually that number has improved a lot in the last couple of weeks, but compared to 85% of our over 70s who've been vaccinated, which means in total, 70% of the people who've been offered a vaccination so far have had it and 30% haven't. And obviously that means that's a group of people who are potentially still exposed to COVID, and who, if they were to be infected, could still die from it. So it's a mixture of good news and sort of not so good news there. And I guess one of the major issues is how do we make sure that all the groups in society get the vaccination? And Dr. Soman Banerjee, who's the Tower Hamlets Council Director of Public Health, he gave some reasons why he thought it was happening in the last Overview and Scrutiny Committee meeting. And then he thought one of the contributing factors may have been people's awareness of the vaccination centres. So, for example, the vaccination centres have mainly been the Cllr Centre in Newham. Lots of people know that place, but lots of people don't. And where they've not been doing the vaccinations has been in local GP surgeries. And he was making the point that if you look at flu vaccinations, that actually the South Asian community actually probably have a slightly higher rate of flu vaccines than the rest of the community. And that had been reversed in COVID, but these latest numbers show that there's been a bit of a catch up, but not within the Black community, which is mainly the Somali community, who is still behind. And trying to fill that gap is clearly a very important issue.
Yeah, I think we need to look at the numbers and just hone in on that. There's been a bit of debate on this ethnicity gap. There was a recent survey brought out by an organization called the Muslim Census, and I know the Muslim community covers very wide minority groups, like diversity in itself, but it was just showing that previously when they talked about the vaccine hesitancy, they looked at very small samples. So they decided to do a very large sample of about 1,500, I think, over 1,000 definitely respondents, and it came up with a different set of figures at the vaccine hesitancy. 70% were favorable towards the vaccine, and then the remaining 30% was either hesitancy or downright don't want to take it, which is a totally different picture. And it just shows that we need to look at figures and look at the facts, and then tackle it in those ways. I think there are issues of underlying health inequalities and how people, just whether we have correct infrastructure. And I think definitely there's a lot of marginalized groups out there, which which have been sort of like ignored in terms of health, public health provision, and that's coming through in terms of the vaccine uptake. And we need to look at that, because one thing about COVID is it's shown that the health of a neighbor, so everybody's health is linked to everybody else. So the health of your neighbor is linked to your, and well-being is linked to your well-being. So, and it's having a different approach to health, and it's kind of welcoming to have those discussions, especially in Tower Hamlets, where we've had massive levels of health inequalities over the decades. I know you've highlighted that we are one of the youngest boroughs, but the other fact is that we have one of the lowest mortality age, average, so like life expectancy. That's it. One of the lowest life expectancies in London boroughs. I think Newham beats us by a year. But after Newham, so it just shows that there's massive issues that have been underlying and has been exposed by COVID. And hopefully by putting in the infrastructure in tackling COVID-19, like vaccine or test and tracing, that we could use that same infrastructure to tackle these other underlying issues. Has there been discussions about that in terms of, I think the conversation I'm having is COVID is going to be with us for years to come, in the sense that a lot of I've heard people saying there's going to be annual rounds of vaccinations because of variations or mutations in the virus, a bit like seasonal flu. So these structures are going to become more and more permanent, and we've seen that with the government having a different approach to health, making it much more centralized. Have those discussions been had in Tower Hamlets as well, that is making us have a different view in terms of how we approach public health?
So I think, yes, I mean, it's widely known, obviously, that we have this problem. It's certainly been in the newspapers a lot over the last couple of days. The Guardian ran a story about London more generally today, I think, as well. But there is one little piece of good news. I was actually just double checking the percentages in January compared to now, because on the 25th of January, we were kind of told at that point that only 37% of South Asians had got the vaccination, and this is people mainly over 80. But now that's jumped to 69%, and that's everybody over 70. So it does suggest that in the last month and a bit, there has been a sort of a bit of a catch up. So, for example, the Black community has gone from 26 to 56%, but the white community has gone from 71 to 85%. So there is still a bit of catching up to do, but it has improved. And I think the other key point about this, and one of the reasons why we're talking about it tonight, is communications. It's the importance of getting the message out there. We've seen the East London Mosque being very active in this area as well. We just need to get the message out to people that is safe to get vaccinated. And we've seen lots of people kind of do pictures of themselves being vaccinated. Prime ministers and ministers, and I think the Mayor of London, I think Sadiq Khan, I think I saw a picture of him being vaccinated as well today. So if he can do it, why not everybody else?
And definitely it's getting the information out. I know I've had phone calls from residents saying, where can I get the vaccine? And I had to explain it to them that it's based on health risks, etc., that it's not based on sort of like on demand, so to speak. You can't have vaccination demand. And so I just explained the risk categories, and they said they're going to ring their GP practices up. But it's just basically just explaining that there's priorities in terms of how this vaccine is rolled out. I know the government, the initial priority was above 70, now it's above 65. I know that there's been a call out amongst frontline voluntary services, groups that do food banks, that they've been asked by Tower Hamlets Council to hand in a list of volunteers as well, because of the risk of them working with people. So it's slowly, but it's just getting that information out. And I feel my advice would be that if you feel that you are in those vulnerable categories, get in touch with your GP practice. You'll getting help from their Tower Hamlets Council has a helpline as well. Go on the website. There's a helpline. There's callers with community languages. If you have it difficulty in understanding or expressing yourself in English, there are community languages. Andrew, is there going to be any further push on this? Is there any development or strategy? Have you, in terms of from Tower Hamlets Council?
No, so the main thing was the helpline that you just talked about to try and sort of get the message across. But the national, campaign is moving at great speed. So they're talking about basically doing everybody over 50 by sort of end of March, April, which is, it's kind of six weeks away. So we're not talking about a huge amount of time, but I think the risk is what we don't want to have at the end of that kind of campaign is groups or gaps within the community. And I think we'll obviously have to focus on those groups at some point to make sure that they're not missed out, because the way things are going, I think, is by summer everybody will have been offered a vaccination. So, and the other point, of course, is in lockdown it's not a huge issue, because at least in lockdown everybody's been protected. The problem is going to come when lockdown starts to lift and people get out into the community more and start to interact with other people. And that will be the point of maximum risk for the older generation, because people in their households might start to work again and be mixing with other people. And it may well be that some of those people are infected. So the risk isn't so much now, but it will be, come April time and May, if lockdown is eased.
No, definitely. And I think the risk hasn't gone away. There is the variants, etc. I've been looking at the COVID dashboard. There are sort of like hotspots in West London, although overall it's going down. And speaking to people in the health profession, that area has been identified as a hotspot for the variant. So we're not out of it, guys, yet. So we need to take those precautions, keep up with the habits of wearing a mask and regularly washing our hands and keeping that social distance. I know at work, when I go in the court, we strictly keep those social distances, and basically ask other people to do that. So we're not out of it yet. And I think the message I'm getting is COVID's going to be with us for quite a while. Andrew, any final thoughts on this before we go for a break?
No, just make sure that your family and friends and everybody gets vaccinated as soon as they can. As simple as that.
Cool. Well, we're gonna shortly go onto a break, but after the break, it's gonna be again livable streets. But there's been a dramatic development or U-turn from the Tower Hamlets Council on this sort of like controversial program, which seems to be dividing residents. But join us after the break, and we'll talk about the ongoing saga of livable streets.